Hypoxia is a condition in which the body doesn't get enough oxygen. Hypoxia is already being considered as a potential treatment for conditions related to aging, including dementia and depression. Trials are now underway to test the effects of increased oxygen on patients with Alzheimer's disease and other age-related cognitive disorders. With our population aging, there will be an increasing need for therapies that combat the effects of aging-related diseases such as dementia and depression. These trials are hopeful in their attempt to find new treatments for these debilitating diseases rather than just treating their symptoms. Hypoxia for longevity is an experimental technique that has been used on humans since the 1920s, with promising results. The benefits of hypoxia are that it has been shown to increase the lifespan of mammals, and it has been observed that even brief bouts of hypoxia have a protective effect on the brain. In a study published in the journal Cell Metabolism, researchers from Harvard Medical School found that mice who lived in hypoxic conditions, which simulate those at high altitude, for 1 month showed an extraordinary ability to regenerate their tissue and heal wounds without forming scar tissue. Another study was published in Nature Communications which found that in mice, 6 weeks of exposure to low levels of oxygen, hypoxia, significantly increased longevity and delayed age-related decrements. Mice in the study were exposed to hypoxic conditions for 6 weeks, which resulted in a 20% increase in average lifespan and significant delays in aging-related diseases such as cancer and cardiac dysfunction. Hypoxia appears to induce HF1 stabilization, which is responsible for the observed anti-aging effects. The idea of using hypoxia for longevity is to decrease the oxygen content in the blood and body tissues, and this should in theory increase the life expectancy. Some suggest that we should also consider using hypoxia as a treatment for acute illnesses such as asthma, emphysema, bronchitis. We would like to hear about your own experience with this topic. Leave a comment. Lastly, remember that it is important to talk to your doctor or other professional before beginning any sort of supplementation or treatments. Feel free to contact us if you want us to give you the contact information of professionals who work with our network.